Hi, I'm Lisa Beyer. I'm the Executive Director of CAT TV here in Bennington, and today we're doing an update on COVID in Vermont and specifically here in Bennington County in the town of Bennington. I'm joined today by Tracy Dolan, who is the Deputy Commissioner of Health, Megan Harrington, who is the District Director for the County of Bennington, Senator Brian Campion, and Dave LaChance, who is the news editor for the Bennington Banner. So I want to thank everybody for being here today. And the purpose really for this program was some growing concern by people about some of the increase in cases here in Bennington. And we thought it would be great to get an update out to everybody and have a better understanding of what's going on in our community. So to start us off, we have a lot of ground to cover. Tracy, can you kind of give us an update of where we stand with the virus in Vermont?
Sure. Thanks a lot. And I'm really happy to be here. So overall in Vermont, as you know, we've generally done pretty well compared to the rest of the country in terms of our COVID rates. However, over the last few months, we did see an increase like we did nationwide. January was the deadliest month nationwide for COVID deaths. Ours occurred in December. And what we're seeing now is a decline in cases. So we're averaging, in the low 100s for cases per day. That's a good downward trajectory. However, what we are seeing is just a generalized spread of COVID. So it's less associated like it was before with specific large outbreaks or specific long-term care facilities, but now we have just kind of a generalized spread where it's popping up in all kinds of places. So we're happy about the lower numbers. We're really excited about vaccine. We have already scheduled more than 35,000 people, 75 and older, for their vaccinations. We've already vaccinated, I think, 9% of our population, and that's going really well. However, all of that being said, the lower numbers, the vaccination, what we need to do is to really stay vigilant and continue to mask up, space 6 feet apart, and not to get together in social gatherings, really avoid crowded places. So overall doing well, but as you know, you're there in Bennington, and I'll hand over to my colleague in a minute. There are some hot spots in Bennington as one of them.
Right. Thank you for that, Tracy. So, Megan, can you provide us with, the highlights of where we stand in Bennington and where the cases are coming from, why the numbers are increasing?
Absolutely. So, I think everyone is so kind of eager to hear, the smoking gun. If there's one situation, one, where we can pinpoint, and that unfortunately is just not the case in our community. We can't contribute this rise to a single source. And actually the majority of our cases since the beginning of December, we've had since December 1st, 714 cases. And out of those, only 88 have been associated with about 15 outbreaks. So the majority of them, we're seeing through households, schools, churches, businesses. We're seeing folks just coming into contact with other folks. And, it's when we start to talk about that and about more of this community-wide transmission, that's when that prevention messaging becomes so much more important. And, because we can't just say, oh, don't get together with you and 100 friends. That's not what's happening. We're really seeing this community-wide transmission within, kind of these smaller settings where people are getting a little bit more relaxed. So
when Megan, I'm sorry, when you say smaller settings, are you talking about workplaces? Are you talking about grocery store, restaurants? Are you seeing any trends?
That's the rough part. We really are. It's a little bit. We've had households spread. We've seen schools, churches, businesses affected, and also, in healthcare situations too. And they're mostly, I would say, to shed like a silver lining, and that a lot of our businesses and our schools and other entities are really familiar with the protocol when a positive case has been identified, encouraging folks to stay home, identifying close contacts, and taking the steps to kind of mitigate further transmission. I think one of the things we're seeing, and I think you mentioned fatigue, as part of this, we're getting into a year of this, in that when folks hear about a possible potential exposure, a lot of folks, who are able, will go out and get a test. They might seek that test a little too soon. The recommendation is 7 days post-exposure from a potential or a known exposure. So if you rush in and get that test 2 to 3 days after, your friend says, hey, just so you know, I've tested positive. If you rush out the next day, that test might not catch a subsequent infection. And so we really ask folks to wait that 7 days. And during that 7 days, we would ask folks to quarantine as well. And I think maybe that's the part that either folks, there's a lot of circumstances that folks can't do that 7 days. Or, they rush out and they do get that test at 3 days and it comes back negative, and it turns out they didn't wait that full 7. We didn't get the full picture. And so I think now we'd really want to stress following the guidance more closely for folks if you think you've had a potential or a known exposure.
So if you get tested, say you're exposed, you get tested after 7 days and it's negative, are you presumably safe after that point, or is there still a potential of infection up to 14 days?
We say you can test out at 7 days. We would ask for you to wait for your results after you get your test. So just if you get your test at 7 days, we'd want you to wait for your results, which usually can take anywhere from 2 to 3 days. At that point, if it's negative, then yes, you would test out of quarantine. Without a test, we'd ask that you wait that full 14 days.
So are you seeing that people are, well, I guess my next question would be the contact tracing. So is there contact tracing going on, and is this being explained to people, but they're not following the guidelines?
There could be some of that. So yeah, our contact tracing team reaches out to every single person with a positive result and runs through an interview and identifies work sites, close contacts. If there is a work site or another entity, such as like a church affiliation or a household gathering, our contact tracing team, reaches out to those close contacts as well to kind of start the process all over. And there's also, I think, what's really important for our community too is, and everyone's community as well, is that part of that interview is actually some care coordination. So there's the question if there are barriers to quarantining. Not everyone, quarantining and not working for 7 days can be quite the luxury that not everyone has the ability to take. And so part of that interview is identifying any resources that someone might need so that they can complete quarantine, so that they are, stopping that transmission.
Dave?
I'd like to follow up with you, Megan, on presumably if we're talking about community transmission, that's another way of talking about, I presume that's another way of talking about compliance, right? You wouldn't have transmission in the community, you wouldn't have spread from stranger to stranger if people were following all the precautions. Is that right?
In I guess the black and white, right? If things happen, right? People come into contact and, there's situations, but, if we set to follow those best practices, 6 feet, masks, uncrowded spaces, things happen and you have the holiday party and maybe one too many people showed up. The next step, the best step you can take is that test and quarantine.
But it sounds like, you hear this more than I do too, but am I coming through? Sorry.
Yes, I heard you. Sorry about that.
You must be hearing the same things that we do anecdotally. It's, you name a business, you name a place, people will say, I'm never going to go to such and such a place again. I can't believe I went there and saw people without masks. I saw people being careless. You must hear those same things that we do. And what I'm wondering is, is that really a factor here? Is that one of the reasons that we're seeing community spread is because you can go into, let's pick a particular store on a Saturday and find shoppers who are unmasked and find no enforcement and no compliance?
We haven't been able to, we haven't seen, I can just speak broadly in that, the situations, we haven't seen an outbreak situation from that. And again, with the shopper, we really think about that close contact as someone within 6 feet for more than 15 minutes. So I would love to see everyone in the grocery store wearing masks. I think I tend to too. I think I've got like rose-colored glasses when I go through the grocery store. Everyone has a mask on. But we really do think, when we're contact tracers are going through that interview process, that is really what they're using to make that definition of a close contact. Someone within 6 feet for greater than 15 minutes. So a trip to the grocery store, passing by your fellow shoppers generally wouldn't meet that. We would generally think of coworkers or, organizational affiliation, household members, things like that, where you're in close proximity for a good amount of time.
It seemed Brian had a question, and then I think Tracy wanted to make a comment.
Sure. I was just going to say more of a comment, but first of all, I just want to thank Lisa and David for pulling this together. This is incredibly important and incredibly timely. And I also want to thank the person who really has been leading statewide on this is Dr. Mark Levine, who has done an exceptional job. And I know Megan and Tracy are both part of his team. So thank you both for that. I think a couple of things, I guess one is a question for Megan. When I talked to Dr. Levine last, it sounded like our testing was up. More and more people were getting tested, but still there were a lot of openings. I mean, there was still room for people to go and get tested. Is that still accurate?
That I've heard very similarly in that our testing in other places of the state is kind of leveling off and Bennington's continues to increase, but we do have open spaces. We do have 7-day-a-week testing here as well through the hospital. And so we would love to see booked clinics every day, that people were pursuing this. But, I think as the health department, we could get a better word out and do a bigger push for testing as an option for asymptomatic folks, who just, have a suspicion or a known exposure, and to use that resource because it's available to everybody.
And the appointments, just to confirm, those are all done online. And if you don't have access to, if you're watching this on Cat TV, if you're not online, what's the best way for somebody to make an appointment?
Tracy, you might have the most up to date on this, but I believe for testing, you can still call 211.
Yep, you can call 211 and they'll transfer you over to the right line.
Great, thank you.
I did want to just add in, this is all, for the most part, driven by behavior. We can actually modify this. This is in our hands. So it is great to get tested. And if you do go to a social gathering, please go get a test. But this really is driven by behavior, and not so much going to the store, although definitely wear a mask when you go out. Yeah. But it really is these smaller engagements. I didn't go to a big party. I had dinner and a few people came over. Well, that's the case. And now there's 6 contacts. So it's these small things. I think we all do it. I do it. I don't do those things. Let me just clarify when I say I do it.
I was like, Tracy.
Clarify. I mean, we start thinking, right? The vaccine arrives. There's just sense of like, I'm already picturing my life in 8 months or 6 months, and it's so easy to get ahead of yourself and start thinking, well, for example, someone called me the other day, probably 2 months ago, and asked my daughter if she wanted to come sleep over and then go skiing. And I'm the deputy commissioner. And I said, that sounds great. And I was like, what? And then my oldest daughter looked at me and said, what are you talking about? And I said, oh my God, I forgot. I was so excited to get back to normal that like my first instinct was sure. And then of course, I called and said, by the way, we cannot do that at all. But
But Tracy, it sounds like, correct me if I'm wrong here, that we're at a moment right now in Bennington County where we really, this is not business as usual. I mean, This whole thing has not been business as usual, but right now, people really, really, really need to stick to these guidelines with masking up, not going to events, get vaccinated when you're eligible, and get tested.
Yeah. Really, the way the governor spoke just before Thanksgiving and just before Christmas, like hunker down, we're into a surge. For Bennington, you are there now.
Okay.
Treat it like just, pre-Thanksgiving, pre-Christmas, it's your family and that's it. And, if you're isolated, it's one other family, but it's really, really hunkered down. This is not the time to be expanding social circles. If you are going to go outside and exercise, do that with one person separated out. But unfortunately, this isn't the time to start adding people into your dinners and saying, well, we'll just go visit for a couple of hours. And I know it's really hard, but this is the time you can get this under control now. This variant will come of the new strain of this virus. It will be more transmissible. You want to get a hold of this now and have a lower number so that if we rise, it won't rise to an out of control level.
And this is about saving lives. This is
yeah.
exactly what we're talking about right now. We're at a moment
Yes.
where we need to really, as you say, hunker down. Thank you for that.
Yeah, and that's why we called this because both Dave and I have been feeling very passionate about the fact that this dialogue is not happening, and we really feel as though it needs to come from our leadership to have people understand that our numbers are increasing. It is community spread, and the stay home, stay safe idea, I think, has gone out the window a little bit. We haven't heard that in a while, and
it hasn't sunsetted. It is still very much with us.
Yes.
So
right.
Yeah.
But I think that reigniting that message that staying home saves lives. I know I've taken that seriously. I know that the people around me have taken that seriously, but it's just vital for us right now. So we want to help you guys get that word out. That's the bottom line. We really want to stop the spread in our community. We want to make sure that people understand that it is dangerous. We understand that there are a lot of hospitalizations here in Bennington right now. And the thing with this virus, as we all know, is you just don't know how it's going to affect different individuals, and you just can't take that risk. Dave, we can't hear you.
Oh, can you hear me now?
Yes.
Okay. All right. Sorry about that. This is probably a question for Tracy, although Megan, you might want to contribute to this as well. And tell me if this is not a valid question, but it's natural to look at our neighboring counties of Bennington and Windham. And by any measure, Windham is doing far better than Bennington is, and by all the measures. And so the natural question, it seems to me, is either what are they doing that we're not doing, or what is it we're doing that they're not doing? Is that even a valid question? Or is it purely it's Bennington's turn to have a surge? I mean, how does that seem to you?
I mean, there were some gatherings early on in Bennington, and we could be seeing a bit of a reverberation from that, even though they weren't recent. The other piece is the ski industry. We do know people are coming in from out of state. We assume some of them are quarantining, but some of them are probably not. They're coming from counties with higher rates. While it's unlikely that they would be spreading it among skiers because you're outside and you're skiing, it's possible that some of the spread we're seeing in the hospitality industry could be connected to that. So there are some parts in the Bennington story that might be a little bit different. And then sometimes you get unlucky. I mean, we had that crazy time in Barrie when a few parties around Halloween just fueled a Barrie surge. And all it took was, I think there were 4 parties, we could literally name them, that pushed that surge. There were a couple of events early on in Bennington, not as big, but that combined with skiing, combined with, just being somewhat unlucky, and maybe a community. I don't know much about the culture of Bennington. There might be, sometimes communities that have a bit of an independent streak, sometimes get a little more relaxed and feel frustrated. Again, I don't know much about the culture of your community, and I don't know how it's different from Windham that way, but probably because it's so widespread, this is probably just, an unfortunate surge, and it is based on behavior, no matter how you look at it. And that's something that you can absolutely control.
I think the folks in Bennington County are really smart, and I think it's just one of these things that's happening. And I know that people are going to rally and put their masks on and follow all the guidelines because it's absolutely essential at this moment.
So, I know for me, and others may have this question, back in March and April, there was such an unprecedented lockdown. And I know that I anticipated after the holidays that we would go back to that kind of life where businesses, it was only essential businesses and things like that. So I'm curious to hear of how those decisions are being made. I'm guessing it's because the, statewide, our numbers are going down. So it's a multi-pronged question. Is there an opportunity for us to impose different rules in one county where there is a surge? So multiple questions in one.
Yeah, the lockdown was helpful in some ways in that it really accelerated a pretty big behavior change around people going out and what they think about doing in their free time. And when we released from that, you didn't see a massive exodus back to those activities. You saw a little pickup in shopping, but some movie theaters are open. They're not crowded. Some restaurants are open. Again, a lot of people just took it out of their way of life. A lot of people rarely go shopping and only for absolute necessities. So I feel like the lockdown did its job in that it really helped reset our expectations around socializing closely to each other. And then we really saw, again, the great behavior change at Thanksgiving and Christmas with people, for the most part, really listening to those guidelines. We didn't see a big surge after Christmas. We saw somewhat of a surge, but it came down. So I feel like it's really about that behavior, whether or not a business is open. Obviously, it could help if a business was closed, you couldn't get in there. But I think it might be, now that we know that we can actually have businesses open, they can be viable, and we can still modify our behavior. Ideally, that's the better way to go, that we're able to maintain business. And if we can think about how do we do business in a safer way, that's more of a win-win. Again, I don't think it's the business settings that are getting us, or the school settings even. I really think it's these personal interactions that are doing it. And those really are within our control. They're hard, but they're within our control.
So, thank you. I know that Senator Campion needs to leave soon. So, Dave, I don't know if you have any last questions, but I wanted to make sure that we did some takeaways about, what messaging can we provide to the community right now in terms of what we need to be doing differently. And also, before we leave, I'd like to get a sense of, how concerned are you about the trajectory of the cases here? So I don't know which one you want to take, or if Dave has additional questions.
Questions too. Those are my questions too.
There is no doubt we're concerned about the case rate in Bennington. It's coming up in almost all of our meetings. We're looking at expanding testing opportunities. We would love to see those testing sites fill up. Again, that's not prevention, but it does give us a better sense of surveillance. And so if you're doing any kind of socializing, go and get a test. And
not to interrupt you, but that would be 7 days after you've had the socialization?
No, that would be right away. And, to stick with Megan's point, if you are a close contact, if you get a test right away, the problem isn't so much that you got a test right away, but you do need to get it again at 7 days. So both are okay. So
Okay.
get a test right away. But if you're a close contact and you want to get tested right away, that's fine. But that's not going to get you out, and it shouldn't give you a false sense of security. But the other piece is we may increase some testing up at Stratton Mountain. So we've talked to our CIC Health there, and they're going to try to promote that. And we're probably going to promote that more among staff and among skiers coming in there to get a better sense of what's happening. But we are concerned. So we're looking at a variety of things, including increasing testing and increasing messaging in Bennington. This is a nice example of what to do.
Yeah.
And I would
Awesome.
encourage, one thing Dr. Levine mentioned in our meeting, share it on social media, do things like this. If people are watching this, share this video, share other information, ask, keeping what Lisa's message of stay at home and save lives. That's also important. And finally, before I do apologize that I do need to leave, but contact your legislators. If you have questions, something that you need assistance with, if you can't find a phone number or an email, that's part of our job and responsibility. So you can find us all online and call or send us an email. But I do want to thank everybody for doing this, and I do apologize, Lisa, but I know you'll continue the conversation.
Wonderful. Well, we're happy that you were able to join us. Thank you, Senator.
Great, thank you.
All right. So Dave, did you have any points you wanted to make?
One thing I wanted to bring up as a possibility, and I think we touched on it a little bit earlier, but that is we have a vaccine. We have more than one vaccine, and thank goodness we do. And I think everybody's thrilled. And we're thrilled that people are getting vaccinated, and that is such a good news story, and that's what's going to get us out of this. But at the same time, I wonder if this focus on vaccination has not taken away or overshadowed the message about stopping the spread of COVID. I wonder if people only hear the vaccination message now and they're thinking, oh, we're out of the woods, and so I don't really have to worry about this, when it's really going to be some number of months before people are protected, the community is protected. Is that right? Do you share that thought?
I think both can live very much simultaneously, that we should have an enthusiasm, a shared sense of celebration for the vaccine and what will come, while at the same time, kind of that hunker down, we still have work to do on this end as well. So I think, as a community, we can celebrate, but also we just need to, it's the fourth quarter. We got to keep rooting everyone on.
But you think that when we talk about vaccination rates, we should also at the very same time talk about, but this isn't the end of it, and we still need to keep, and I worry that second half is falling off. We're not saying that.
Yeah, we do that. Sometimes it's a little bit driven by the media, especially in this first week of vaccination that we just had. There was a lot of media interest and a lot of consumer interest. There's also a cognitive dissonance between a person thinking about vaccination and feeling like that's the life-saving medicine, and at the same time, and I shouldn't change any of my protective behaviors. It's just a human, natural cognitive dissonance, and that's hard. And we just have to keep pushing up against that and saying it's yes, and yes, you're getting this vaccine, and it's going to be a few months before that makes a difference in your life. That lag is hard, that deferred gratification of such a great thing to do. And so we just have to keep messaging that. But I would agree, we get a lot of questions about the vaccination, and it's really up to us in public health to tag every answer with, yes, this is how you register. And please remember to wear a mask and do all these things in the meantime. And we have to just keep tagging every answer.
Mm-hmm.
So, I guess we've had some takeaways here. More testing, behavior changes, spreading the word, spreading the message that, people need to remain vigilant. I know one thing that we started doing here at Cat TV was doing daily number updates. So we're doing that on the channels and on Facebook every day, hoping, I started this about 6 weeks ago, hoping that, it would alert people to the changes that we were seeing here. I'm not sure if it's had that effect yet, but I'm going to keep trying. But are there other takeaways, things? Obviously, the banner will be, doing, I'm sure, article on what we've talked about today. We'll be replaying this program on Cat TV and on our Facebook page. What else can we do right now to help you? Is there anything?
I think continuing to promote the messaging and, coming at it from like a strength base. Was it Brian that just said, we got an independent, or Tracy, an independent streak down here. And we should use that to our advantage. and that it is on us and it is our behavior changes, and we can support our family and neighbors in making those decisions. If you have someone as entering quarantine, and giving them that support and acknowledging that they're making the right decision for themselves and their community. Do they need groceries? Do they need their medications picked up? Can you schedule a Zoom coffee hour with them? And turning the lens so that we're supporting each other in these decisions, I think is a big one.
Yeah, that's interesting. When you think about in the spring, everybody had the rainbows in their windows, and it was, we're all in this together, and stay home, stay safe. And I think there is a lot of fatigue and complacency. Reigniting those kind of things that I think created unity in the isolation would be helpful, a helpful message. I also wonder if there's something that we could be asking our town, is there something our town leaders could be doing differently? Is there, the hospital, I know has been incredible. We've been doing regular updates with them. But are there things along those lines that you can think of?
I think just encouraging the messaging, and we don't want any stigma or shame. If people have, broken the rules, we want instead supportive corrective action. And so really encouraging people, to go out and get that test if they may not have been able to stick to the rules. And I do wonder about, kind of challenging Bennington internally, like, let's get these numbers down, let's have a Bennington challenge, let's see if we can get these numbers down all together. Reestablishing your own personal commitment, because at the end of the day, it's about personal commitment. So, what am I going to do differently in the next 2 weeks? I'm going to look at my own life and what I'm doing, and I'm going to bring down the risk. Maybe I'm going to, make sure I'm masking up in this one place where I wasn't, or, maybe last week I had a friend over. Okay, I'm going to cut that out. Maybe my kids weren't gathering in this way. I'm going to decrease that. So what are all the small ways in my own life? And if each person does that, that'll bring down the risk as well. But the strength-based part of this is that, luckily, it's a highly transmissible virus. However, it is not out of our control. It really is in our control. So we've seen other counties turn it around. You'll be able to turn it around too.
Good.
Up on that, and I'm glad you brought that up, because I know from a personal level, I know that for some people it's very difficult for them to say, I don't want to go to your house, or I don't want to meet with you. If I meet with you, I'm going to wear a mask, and don't think I'm accusing you of being careless. This is to protect you. But people, I think some people more than others have a hard time saying that or making that choice. Is there any way of supporting them in doing that, doing the right thing?
Yes, it can be really helpful to quote Dr. Levine or the governor, and I've seen people do that. I mean, you can see it on a store, as per a governor's order, as per the state of Vermont. You can do that in your own. Oh, actually, I heard Dr. Levine on the radio, or I heard Tracy Dolan, or I heard Megan, or whomever, and the health department said that we can't do this. And it really takes all the decision making away from you, because there's this sense of, you hear people say, oh, she's really COVID cautious. You've probably heard that phrase, or right? And it's almost seen as like, oh, they're almost like too concerned. Like, I think they're not well kind of concerned, But yes, but go ahead and blame us. We would love it. You say, you know what?
Absolutely.
I wish I could have you over. I mean, I've done it, I was invited to something around Christmas, and I'm like, my boss is Dr. Levine. I can't do it. And so go ahead and blame us and say, you know what, I'd love to, but the health department's really clear. And so I'm really trying to abide by the rules. And then you don't have to say it's about your own concern if you don't want to. So easily push it up. Megan and I will take it, right, Megan?
There
Oh,
you go.
absolutely. Blame us. I remember hearing from this summer, someone had printed out like a life-size Dr. Levine at a outdoor festival. Dr. Levine is watching you. So
That's great.
all
That's
kinds of
great.
creative options.
Well, I think, there was something you said that made me think maybe Dave and I could come up with something, the personal challenge. What did you do different in your daily interactions to help stop the spread? Some kind of campaign around that between Cat TV and the banner could really be something to get that community willpower to hunker down. So there's some opportunities there. Well,
I love it. Who doesn't love a challenge?
Yes, yes.
Friendly
Dave,
competition.
we couldn't hear you.
Oh, I was just wondering if anybody has seen a campaign like that conducted anywhere that's had success.
I'm not familiar.
I haven't, but a lot of people don't want to think that they're already doing something wrong. So if it's framed as, what, we all have little pockets of risk, so what are all the little things we could do? And then having role models say something like, what, I'm going to do this slightly differently, or I'm going to, move as 1 foot away, or, whatever it is, further than I was. Because I think what people don't want to think is that we're suggesting that they're doing anything wrong. And so maybe it's a we, what can we all do to reduce our risk a little bit more?
Yeah. Awesome.
I have a question about metrics too. And that's, the number that we've been using, one of the numbers we've been using is the number of cases per 10,000 people since the beginning of time. And, that's one measure. And that's the number by which Bennington leads everybody else. But that doesn't tell you what's been happening over the last 2 weeks. It tells you everything since March, right? We don't have a number for the last 2 weeks. We're on that big state map and we're in dark blue, which means more than 80. But how many more than 80? We have no idea. We don't really know how we're doing. If we're medium blue or light blue or dark blue, that seems to be the only kind of measure we have. And I was shocked to find out that half the people hospitalized in Vermont with COVID are in Bennington County. I didn't know that because I don't have the numbers for how many people are at SVMC. I don't know. It's only talked about on the statewide level, which again isn't very helpful for your community. So is there some way of getting more helpful numbers, more useful numbers?
So you're wondering, so the people per 10,000 is a rate, and that's a common epidemiological rate. And you're wondering, how do you know what the rate is over 2 weeks versus since March?
That seems to be a more useful number, I would think, over the last 2 weeks would make the most sense.
Yeah, I'll look into that, how we establish those rates and the time period. In terms of hospitalizations, I know we put up the total hospitalizations. We don't run it down by county. And I'm not sure if the hospitalization numbers are low, we don't release them per hospital because it could identify then who it is. Because if you have a low number of people in a hospital with a particular disease, and I happen to know someone with the disease, then I might know that they're in that hospital. There's some data suppression we do to protect. But more broadly, I don't know what the barrier is or if we've ever run it by county. So I'll have to look into both of those questions. Megan, do you have any thoughts there?
No, I think that was the same thought. Kind of when the numbers are low, it is easier to, in smaller communities, you might be able to pinpoint someone. So that's why, with my same understanding.
Okay. Well, if there's nothing else, I think I can let you guys go on to your busy days. So I really appreciate everybody joining us today. And I'd like to keep the conversation going. Megan, maybe this is something that, the three of us could work on down here and doing, more outreach in the coming weeks as we get our numbers down. So.
Absolutely. I really appreciate you coordinating this, and it would be my pleasure to join you on a regular basis and keep the drumbeat going.
Good.
Yeah.
Well, and thank you both for all the work that you've done through the whole pandemic. We are very grateful and thankful to live where we live. So I know that the numbers that we're facing here are nothing compared to some of the things that other states are facing. So it's a lot due to your hard work and planning and execution. So thank you.
Thank you.
And with that, we will end today's show, and hopefully we'll be back again soon. Thank you.
Great. Thank you so much.
Bye.
Bye-bye.